Welcome, everybody. My name is Marty Mascari. I'm with the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, both of which are under the North Central Texas Council of Governments in North Central Texas. We're blessed again today to have my partners in crime from the North Central Texas Area Agency on Aging, Melinda Gardner and Felicia Warner. And we're here to talk about Medicare Monday, and we also have our partners with the Better Business Bureau Education Foundation. Angela's here to talk to us about holiday scams as well. But before we get started, if we could go to the next slide, and we're going, I'm sorry, it's Angel, right? And
yes, it's Angel.
Didn't I? I'm so sorry. I'm very sorry. So before we get started, I want to talk about the CEUs for today. For those of you that are joining us for CEUs, today's webinar, for participating with us, we're set up to provide CEUs for licensed social workers and licensed professional counselors in the state of Texas. We're also providing certificates of attendance if you'd like those. The guidelines are the same. Now, if you have a different license within Texas, or you have a license outside of Texas, you're more than welcome to go through the process and get the certificate. I've had people tell me they've been able to use them in different jurisdictions, but there's no guarantee of that. But you're more than welcome to go through the process and do that. Today's webinar is worth 1.5 hours of CE credits. You must attend the entire live webinar or the entire recorded webinar with live Q&A this afternoon. You must complete the Google survey evaluation that should pop up as you close out of Zoom today. If it doesn't pop up, you will receive that additionally, that link in the follow-up email that will go out tomorrow morning. The Google survey will be up for 1 week till 5 p.m. next Monday, and then give us about 3 weeks after that to get the certificates out to you. And I'm going to turn it over now to Melinda and let Melinda introduce our speakers. How's that?
All right. Well, thank you very much, Marty, and thank you everyone for joining us today for Medicare Mondays. And hopefully we will come up with a tricky or a catchy phrase for our midweek one. I like what Angel came up with. But anyway, yes. Thank you all for joining us. Today we have two wonderful speakers, and we are going to start off with Felicia Warner. I'll let her introduce herself, who will be talking about Medicare and the marketplace. Felicia, I'll turn it over to you.
Thank you, Melinda. Good morning, everyone. My name is Felicia Warner. We are the Area Agency on Aging of North Texas, a program of the North Texas Central Council of Governments. We're also known as SHIP, and I can explain that shortly. We also partner with the Texas Senior Medicare Patrol to provide information on fraud and abuse, and we are presenting today with that Angel today with that, who will share that information on holiday scams. So we'll go to the next one. SHIP is the State Health Insurance Assistance Program. We're federally funded, to provide free local services to persons ages 60 and older and caregivers and Medicare beneficiaries of any age to help maintain health, obtain public and private benefits, and to protect their rights. Again, SHIPs are federally funded. It was established by Congress, and their work is funded by the U.S. Administration on Community Living at the U.S. Department of Health and Human Services. Go to the next slide. And this is just a little small snapshot of SHIP. There are 54 SHIPs, one in every state, Puerto Rico, Guam, DC, and the Virgin Islands. There are over 2,200 local programs, over 12,000 counselors, 4 million individuals who have been educated, and 2.5 million counseling sessions. That's a lot of sessions. I think, Melinda, we did that during open enrollment. So we increased that number by a lot. SHIP, the State Health Insurance Assistance Program. SHIP can help you understand your costs and your coverage, which is very important. Compare options, enroll or change plans, or help correct billing issues. And billing issues can be quite daunting for our seniors, so we always encourage them to call and let us help you and let us assist you in getting those claims corrected. And it can be just common billing errors. So we really help our seniors get that corrected. Okay. And this is the SHIP landing page. Find your local SHIP office or visit ship.org or call that number 877-839-2675. It's a source of information, expertise, and technical assistance for grantees that will help you understand more. And here's a little video. Melinda, can you play that or?
Many people find Medicare confusing. Make it easier and make a difference. Volunteer with your local SHIP and help people in your community navigate Medicare. You can volunteer virtually or in person, one-on-one or in groups. There's a wide variety of volunteer roles. You don't need a background in health insurance to get involved. SHIP provides the training.
I don't get paid for this. I'm a volunteer. And I get more out of doing this than what I did on a paycheck.
It's just a joy, a blessing to help and to give. And it doesn't take very much of your time.
If you go through the training, you give it a chance, you'll see the value not only for yourself, but you also see the value in others who you're able to assist.
As a SHIP volunteer, you can give back to your community, stay connected, and build your skills. Contact the SHIP office in your area to learn more. Depending on your area, the SHIP program may also be known by one of these names.
That was great. I just want to put out to everyone.
Many people
I started as a volunteer. I worked full time, and I saw the need in the community to help our seniors, especially the low-income seniors that I work with, understand more about Medicare and what their options are. And I started as a volunteer in 2009 and have really enjoyed it. And now I work for the agency, which I really love working with our seniors in the community. So the marketplace to Medicare, what to expect. We're going to focus this session on the health insurance marketplace, sometimes called the marketplace or exchange, and what people with Medicare need to know for Medicare enrollment and eligibility information. We can review getting started with Medicare, and also this training was developed and approved by the Centers of Medicare and Medicare Services. Go to the next slide. So during this little session, we will talk about to identify considerations if you are enrolled in the marketplace coverage and become eligible for Medicare, explain the programs that can help you pay for Medicare, explain the periodic data matching, PDM, which is fascinating, but we're going to learn more about that, and locate Medicare and marketplace resources. Okay, you're turning 65. It's wonderful. Some people dread it, but I can always consider the alternative. So this section will address these questions. What should you consider when deciding to enroll in a Medicare Part A and Part B, when you must enroll in Medicare Part B, and what else should you consider when deciding whether to enroll. And there's many decisions that you do need to make. What should you know about Medicare enrollment periods? What factors, and when should you consider keeping your health insurance marketplace instead of Medicare? How do you cancel your marketplace plan? If you have a marketplace plan and are about to turn 65, you may soon be eligible for Medicare. The marketplace will mail you or someone else on your application a special notice called the Marketplace Open Enrollment Notice, informing you that you may soon be eligible for Medicare and can change your health coverage. There are different ways to enroll in Medicare. There may be late enrollment penalties if you don't sign up when you're eligible, and we're going to talk about that because that is, every time I hear penalties, it's scary. You may cancel your marketplace plan when you sign up for Medicare, or you can keep it, or you may lose your financial subsidies. So go to the next. What to consider enrolling in a Medicare Part A hospital insurance. Most people don't pay a premium for Part A. Your monthly premium may go up to 10% if you don't buy it when you're first eligible. You can't contribute to a health savings program, which is the HSA, if you have Medicare. You're not eligible for the marketplace premium, tax credits, and cost sharing reductions. Part A is considered qualifying health coverage. And we have to keep that in mind. Your monthly premium may go up 10% if you don't buy it when you're first eligible. What should you consider when deciding to enroll in a Medicare Part B medical insurance? Most people pay a monthly Part B premium. It's usually deducted from your Social Security, your railroad retirement, or a federal retirement payments. The amounts depend on your income from 2 years ago when you enrolled in a Part B, or if you're not getting Social Security or Railroad Retirement Board benefits, there are 4 ways you can pay your premium. Of course, you can pay online. You can use your credit card or a debit card, pay directly from your savings or checking account, or sign up for Medicare Easy Pay, or make your payment by mail. You don't have to sign up for Part B. If you get the later, you may have to pay a lifetime enrollment penalty, which is added to your monthly premium. People who don't get a retirement payment or whose payment isn't enough to cover the premium will get a bill from Medicare for the Part B premium. The bill can be paid by credit card, check, or money order. Go to the next slide. Enrolling in Medicare automatic enrollment. Enrollment is automatic for people who get Social Security benefits or the railroad benefits, or you can get ready, look for your package in the mail they'll send to you 3 months before you turn 65, or the 25th month of your eligible benefits, your disability benefits. Is included in your Medicare card and your Medicare card. The next slide. Enrolling in Medicare, your initial enrollment period, the IEP. If you're not getting Social Security at least 4 months before turning 65, you can sign up for Part A and Part B during your initial enrollment period. You can enroll through Social Security or the railroad retirement, or your coverage begins based on the month you were enrolled. And again, your first opportunity to enroll in Medicare is during your initial enrollment period, which lasts 6 months. And if you're not getting Social Security at least 4 months before turning 65, you must sign up for Part A and Part B during your initial enrollment period. If you enroll during the first 3 months of your initial enrollment period, your coverage will begin the first day of the month you turn 65. If you enroll during the month you turn 65, your coverage will begin the first day of the next month. If you enroll in the last 3 months of your initial enrollment period, your Part A and Part B coverage, your Part A, if you have to buy it, and your Part B coverage will begin 2 months after you signed up. So it's always important to sign up on time when you're eligible. If you're eligible for a premium-free Part A, you can enroll in Part A once your initial enrollment period begins and any month afterwards. If you're not eligible for the premium-free Part A, you can only enroll in Part A during your initial enrollment period or during the limited Part B enrollment periods if you don't, or you may have late enrollment penalties. And again, I get the shivers every time I think about late penalties. So next slide. No one likes to pay penalties, so it's always important to start your Medicare when you're eligible, unless you have special circumstances. You can only sign up for, what if you missed your initial enrollment period? You'll have to wait until Medicare general enrollment period, January 1 to March the 31st every year. Coverage begins July the 1st, and that's a long gap right there. If you have more than 12 months, if more than 12 months have passed since turning 65, you could have a lifetime late enrollment period. And see how that goes, a lifetime? You just don't want to ever have to be in that situation. You can only sign up for Medicare during certain enrollment periods. You have to sign up. If you didn't sign up for Part A or Part B during your initial enrollment period, you can sign up during the Medicare general enrollment period. For most people who don't sign up during their initial enrollment period, this is their only chance to sign up. So we'll go to the next slide. Canceling your marketplace coverage due to Medicare eligibility. And this is another important factor. Ending your marketplace coverage due to Medicare eligibility is different depending on whose coverage. If it's yourself only, or you have your household. Next slide. Canceling your marketplace coverage for yourself. Canceling your marketplace coverage for yourself. You can request your coverage in immediately, or you can request a date in the future. And that's an important difference. If in some cases your coverage won't end immediately, for example, when your household members who remain enrolled in the coverage qualify for a special enrollment period and must re-enroll. You can end marketplace coverage by logging on to your healthcare.gov account if you're the only one covered, but you must call the marketplace center if you're you're disenrolling for your family. Next slide. Canceling your marketplace coverage household plan. Call the marketplace center on the day you want your members' coverage to end. That's for the whole family or each individual. Don't change or end your marketplace coverage online unless you're ending coverage for everyone on the plan. To end coverage, you must for some people, call the marketplace to ensure that you have the correct end date. In most cases, the removed member of the coverage with the coverage ends right away. Keeping a marketplace plan and Medicare. If you have a Medicare marketplace plan, you can keep it until your Medicare coverage starts if you like, but you can keep your marketplace plan too once your Part A coverage starts. Marketplace coverage duplicates the coverage you get from Medicare. You no longer qualify for advance payment of the premium tax credit or other cost savings you may be getting from your marketplace plan. You may have to pay the full price of your marketplace plan. Medicare does not coordinate, and that's very important, Medicare does not coordinate benefits with marketplace plans and doesn't work as Medicare supplement, Medigap coverage, or secondary coverage. There is little or no benefit in keeping a marketplace coverage once you are eligible to enroll in Medicare. In most cases, it's best to sign up for Medicare and drop your marketplace plan when you become eligible for Medicare. If you're not eligible for the premium-free Part A, you can choose to keep your marketplace plan to get your coverage. The coverage will cost less. At the end of the plan, the federal marketplace may end your marketplace when marketplace coverage is duplicated by Medicare. Go to the next slide. Okay, keeping your marketplace plan instead of Medicare. And that's a big decision if you want to keep your marketplace plan instead of Medicare. So it's some scenarios that we'll go over. Most of the time, it's best to have Medicare. There are some situations where you can keep your marketplace plan with premium tax credits instead of having Medicare. If you're eligible for Medicare and haven't enrolled in Medicare due to having to pay a premium for Part A, have a medical condition that qualifies you for Medicare, like end-stage renal disease, or you haven't applied for Medicare. Being in a 24-month disability period. If you're enrolled in Medicare and you're paying a premium for Part A, you can drop Part A and Part B coverage and get a marketplace plan instead. Consider your needs and your budget. In most cases, Medicare will cost less than the marketplace plan without the advanced premium tax credits. If you're getting advanced payments for the premium tax credits while you have the marketplace coverage and Medicare coverage, you may have to pay back all or some of your tax credits you received the months you were on the marketplace. Go to the next slide. Considerations. Marketplace plans may not pay claims that would be covered by Medicare Part B if you're eligible for Part B but didn't sign up. Some plans are doing this even if you have to pay a premium for Part A. While not common, these cases have resulted in devastating financial implications for gaps in coverage and even though the individuals paid their marketplace premiums. So it's best to always make sure you can, we'll get into that later, that you can call the navigators or call SHIP for more information. You should contact your Medicare, your marketplace plan, to ask about the policies related to this prior to enrolling in Medicare. The need to enroll during the general enrollment period or the special enrollment period if you qualify. Be responsible for a lifetime Medicare Part B late enrollment penalty. And there we go with the late enrollment penalties. If you decide to end your Medicare and it's ended retroactively, you'll have to pay back any claims that Medicare paid during this time. And again, they're saying it's just not much benefit to choosing a marketplace plan for coverage instead of Medicare. And this is a cute little quiz. If you delay signing up for Medicare and decide to sign up later, you can sign up and Miss A, at any time with no penalty. B, during certain times with no penalty. C, during certain times if you qualify, but you have a late enrollment penalty. And again, that late enrollment penalty is really not worth it. So we're in the next section, programs to help pay for Medicare. In this section, we'll discuss programs that can help people with limited income and resources to pay for Medicare. Medicare Savings Program, extra help for drug costs, and steps you can take to find out if you're qualified. If you are transitioning from the marketplace to Medicare coverage, you may be concerned because you got a tax premium credit for the marketplace, and that helps you with that premium cost, and you'll lose that, and you're concerned about it when you qualify for Medicare. You can get help from your state paying Medicare costs if you have limited income and resources. These programs are frequently have higher income and resource guidelines than the full Medicaid, and are helpful if you've had premium tax credits or cost-sharing reductions in the marketplace. These programs are collectively called the Medicare Savings Program. This includes qualified Medicare beneficiary, the QMB, specified low-income Medicare beneficiary, SLMB, qualifying individual, QI, and qualified disabled working individuals, QDWI. These programs are available, and I'm during open enrollment, I talked to several people who did not even know these programs existed. So we want to stress that if you're transitioning from the marketplace and you were dependent on that premium tax credit and you are worried about that, please contact the SHIP office that can help you. Go to the next slide. Oops. Extra help for drug costs. Extra help is a program to help people with limited income and resources pay for Medicare Part D program costs, and that's the drug program, like premiums, deductibles, and co-insurance. It's also known as the Low Income Subsidy, LIS. If you have the lowest income and resources, you'll pay no premiums or deductibles and have small or no copays, which is really helpful. If you have slightly higher income and resources, you'll have a reduced deductible and pay a little more out of pocket. If you automatically qualify for this, or you've applied for extra help, and you won't have the coverage gap or late enrollment period. Again, if you automatically qualify, or you apply and qualify for extra help, you will not have the coverage gap or late enrollment penalties. That'll be taken away. And you'll also have a special enrollment period and can switch plans from one time a year in the calendar, one time per calendar quarter in the first 3 quarters of the year. I'm sorry, I got that. If you want to change plans in the 4th quarter, you would use the annual open enrollment period to find your level of extra help. Go to the next slide. Qualifying for extra help. You automatically qualify for extra help, and you don't need to apply if you have Medicare and get full Medicaid coverage. Supplemental Social Security, income, SSI, and benefits, or help with Medicaid paying your Medicare Part B premiums. Extra help is really an excellent program, and people do need to apply for it if they are eligible. And then sometimes if their income is just a little over, they might qualify for the other programs that I mentioned. But you'll need to apply, and if you're denied, you can reapply. And under certain circumstances, eligibility for extra help may be determined by either the Social Security or your state Medicaid assistance program, Medicaid office. You can apply for these programs by applying through the Social Security, completing a paper application, or get one by calling Social Security anytime during your state, your Medicaid office, working with your local organization, such as the State Health Insurance Assistance Program, SHIP. Apply to find out if you qualify. Again, it's very important that if you think you may qualify for extra help with your Medicare costs, review your income and resources, and get your documents together, your Medicare identification number, Social Security, residence and income, and do that. We openly just always encourage individuals to do that. Go to the next slide. Again, it's a little test. Check your knowledge. You automatically qualify for extra help for Medicare drug costs if you get help from Medicaid paying your Medicare Part A and or Part B. And that is true. Getting help from Medicaid help from Medicaid paying your Medicare Part B premiums, all others must apply through Social Security. And here we are at the Medicare periodic data matching. I must confess I didn't know a whole lot about this part, but it was really fascinating as I got into this lesson. What is PDM? What's new for PDM? What's the PDM process? So it's quite fascinating. So let's take a look. Medicare periodic dating matching is a process that identifies whether you're enrolled in a Medicare Part A, hospital insurance, or a Medicare Advantage plan, and marketplace coverage by matching enrollment data. You're notified by the marketplace if you're getting premium tax credits or cost sharing reductions and have Medicare and a marketplace plan. If you have been found eligible for or are signed up for Medicare, you're generally you're not eligible to receive financial help to pay for marketplace plan, premiums, or covered services. You should follow the instructions listed on your Medicare periodic data matching notice. The Medicare notice will include your name, a recommendation that you should end your marketplace coverage, instructions on how to end your marketplace coverage, or financial help that you received during the marketplace or sign up for Medicare. Part A, or a Medicare Advantage plan. The date that you must apply to the notice before the marketplace will take action on your behalf. Where to find contact information to confirm that you're enrolled, or if you have any questions about Medicare. Go to the next slide. The marketplace will end premium tax credits and cost sharing reductions for you if you're enrolled in both the Medicare and the marketplace. A statement was added to the application to act on your behalf to end the coverage. It states that if anyone on your application enrolls in coverage through a marketplace plan, but is later found to have other qualifying health coverage, Medicare, Medicaid, CHIP, or have the option to allow marketplace to end your marketplace coverage if you agree to the statement. If you have both Medicare and marketplace plan, you'll have just 30 days from the date of the notice to return to the marketplace to either end your premium tax credits or cost sharing reductions, or in your marketplace plan if you choose. You'll have to get specific instructions on your periodic data matching notice to what's based on your Medicare enrollment status. You'll have to have you'll also have options to disagree, and you can disagree, but again, that periodic data matching is going to allow you to have 90 days to resolve this issue. After the 90-day window, the marketplace will then take action to end your tax credits or your cost savings reductions, and you probably will have some issues to change that. So it's important to follow the instructions on the notice if you receive one from the periodic data matching if you are on the marketplace and Medicare. Check your knowledge. If you have a marketplace plan, you're eligible for tax premium, credits, cost sharing reductions, even if you also have Medicare, and that is false. If you have both Medicare and marketplace plan, you should immediately return to the marketplace to either end your tax premium tax credits or your cost sharing reductions, or to end your marketplace plan. They're very serious about that. Don't miss your key dates and information about the health insurance marketplace. Here's how you can stay connected to get updates. You can, email, you can text, you can Facebook, YouTube, the health insurance marketplace blog, a number of places that you can get connected to. You can talk to an agent, broker, or navigator in person to help you get assistance, or you can again call a SHIP office. Next slide. And if you still need health insurance, you can also go to the healthcare.gov or healthcare.gov/C plans for more details. If your state has its own marketplace, then you can go directly to that website. Next slide. This is again helpful information, a quick start goals guide, and some other information that you can check out. The next slide. Get help applying and more. Just gonna search for agent or a broker or a sister, or go get connected to a local agent. Get contacted by a local agent or broker. Next slide. The health insurance marketplace through CMS. And you can use this website to find information, up-to-date information, or to help counsel people in your organization who may benefit from the health insurance marketplace plans. Marketplace assisters and navigators. The trained navigators and assisters can help you at no cost. You're not eligible for Medicare and want to enroll in the marketplace, which is very important. You need help understanding your options on when to transition from the marketplace to Medicare. You need help managing your marketplace plan. They will help you understand options about enrolling in the marketplace, understanding factors to consider when ending coverage. And it's very important that you end it on time to forego any penalties that you might accrue over a lifetime that you're on Medicare. Advanced premium tax credits. Refer to your SHIP counselor or Medicare counselor to help find a navigator or assister in your area. You can go to localhelp.healthcare.gov. And if we have enough time, Melinda and Marty, do you have enough time to go through a marketplace scenario?
I would say let's bypass that. This is in the handouts, so
Okay.
individuals are able to go through that on their own. But if they do have questions, we can definitely, they can definitely reach out to us for that information, because some of it is confusing. Let's go right to the key points to remember.
Okay.
And then we will move along here. There are several scenarios for marketplace, and there were some questions in the Q&A, which we will get to also. Thank you, Felicia.
Okay, thank you. The key points to remember: Medicare isn't part of the marketplace. And some people get that confused, and it can lead to big problems. Again, I shiver every time I think about lifetime penalties. Most of the time, it's best to have Medicare. If you have premium-free Part A and keep your marketplace plan, you must pay the full price. And the full price of the marketplace plan premiums. You may need to return to the marketplace plan to end your premium tax credits. You may have to pay back all or some of the premium tax credits paid on your behalf for the months of overlapping coverage. And I'm sure those costs can be enormous. So we don't ever want that to happen to anyone. And also more key points to remember: if you don't enroll in a Part A, if you have to buy it, and a Medicare Part B insurance, during your enrollment period, you may have a late enrollment penalties when you decide to enroll, a gap in coverage if you have to wait until Medicare's general enrollment. Timing is important when canceling your marketplace plan. Medicare isn't a part of the marketplace. Most of the time, it's best to have Medicare. If you already have Medicare, you probably can't enroll in the marketplace. It's just important to do everything on time. And here are some Medicare and marketplace resources. The CMS, the Medicare website, medicare.gov. Facebook, I wasn't aware of that. That's a new one, for me at least. Your SHIP, help.org, healthcare.gov or marketplace, medicaid.gov, insurekidsnow.gov, or ssa.gov. So here is Medicare and marketplace products. There is some more information if you want to follow this at cms.gov / Medicare eligibility, and you can see that in the Medicare and health insurance marketplace. So that's some more helpful information. Again, thank you. This is Felicia. I appreciate you all taking time out of your day to and join our Medicare Monday. Thank you, Melinda. Thank you, Marty.
Thank you very much, Felicia. And we will move to SMP if Angel is ready. And I believe I can give her remote control. And
Yes, I believe so.
Let me know if that worked.
Okay. See, is anything happening for y'all? There we go. Okay. So hi, everyone. I am Angel Hanzik. I am the outreach specialist with the Texas Senior Medicare Patrol. And today we're going to be talking about holiday scams. Okay. So first, is that working for y'all? It's not following my command.
It hasn't moved yet. Okay, try it now. Go ahead. No? There we go.
There we go. All right, awesome. So just a couple housekeeping rules. You can go ahead and use the chat feature. I have it up on the side of my screen. So if you have any questions, but then of course we're going to answer live questions at the end. We're also going to be doing a little game throughout the presentation just to keep things a little exciting and because it's the holidays. So we're going to be doing a Find the Grinch game. This Grinch picture that you see over to the right, we have it hidden a few times throughout the presentation. And so whenever you see him, if you could just type in the chat Grinch and what scam it is, the slide that you see, the first person to put that in the chat will win a Senior Medicare Patrol tumbler. So it looks like this. It's just a cute little cup with our information on it. I'll be watching the chat. There's 4 chances to win and you can only win once. So unfortunately you can't have 4 tumblers. But yeah, if you're the winner, I just want to let you know, I'll private message you and I'll get your information so that we can send that over to you. So just be on the lookout for our little Grinch. So what is the Texas Senior Medicare Patrol? So we are a federally funded program and there's one of us in every single state as well as the U.S. territories. And so we are Texas specific. What we do here is we recruit and train volunteers and professionals about Medicare fraud and abuse so that we can just distribute that information and try to prevent Medicare fraud from happening. We're also a reporting agency, so you can report fraud to us, fraud and abuse to us, and then we report it to the correct Medicare fraud control units. And so we have a hotline, completely confidential, that you can call and report anything suspicious on your MSNs, any sort of suspicious billing or supplies that you've received. So to kick this event off, first we're going to go with a Medicare fraud alert. So right now, a big scam that we are seeing is Medicare beneficiaries being charged for diabetic supplies and actually receiving diabetic supplies in the mail, or having charges on their Medicare summary notices for diabetic supplies when they're not even diabetic. They've never been diabetic. They don't need these supplies. And so that's the biggest telltale sign. It can also happen to Medicare beneficiaries who are diabetic. And so it may go unnoticed that they're being charged extra or double for supplies that they might not need or never receive. So please be watching your Medicare summary notices. And if you see something suspicious, please call the Texas Senior Medicare Patrol. Our hotline number is listed here, and I'll also have it throughout the slides and at the end of the presentation. So let's go ahead and get started with our holiday countdown. So on the 12th day of the holidays, a true scammer sent to me misleading social media ads. And so I'm sure that you've all seen it. It's awesome on the holidays. The items that you want are on your social media and they're at a huge discount. You see it on your Facebook, on your Instagram ads, and it's 50% off, 75% off. But then you order the item and you may never receive it. Or you may actually end up signing up for a free trial where you end up being charged monthly after. So it's not actually free. The item may even be counterfeit or stolen, which is very popular, which is why it is able to be sold online for so cheap. So make sure that you're always researching before you buy. Be suspicious of those random ads that are popping up. I'm sure we've all said something in front of our phone like, oh, I really want an Alexa. And then the next day on your Facebook, you see ads for that Alexa coming up. So just be cautious of things that are popping up on your social medias. On the 11th day, we have the social media gift exchange. So I'm not sure if y'all have ever seen this before, but it's been very popular on Facebook in recent years, where you might get joined into like a big Facebook group or a big, I see the chat blowing up with Grinch. But yes, the social media gift exchange, you may be added into a Facebook group of a bunch of people. And so you just have to buy one gift at $20 or $30, and then you'll get a gift from someone else or from everyone else in the group. And it sounds so awesome, but it's actually a pyramid scheme, which is illegal. So please be cautious of any sort of group that you get put in that's trying to do this, especially if it's strangers, people you don't know. Go ahead, if you want to do a gift exchange, set it up with your family, your friends, create your own Facebook group of people that you know and trust. And I'm sure you'll get better gifts than what you'll receive here, which is nothing. The newest version of the scam includes bottles of wine, which is very tempting, but so just be wary of that. And we say, jail is not jolly. Okay, and the Grinch has been found. Thank you. On the 10th day of the holidays, we have grandparent scams. So here, you may have seen this maybe on TV or heard it from someone that you know, but it's very popular during the holiday seasons for someone to get a call from someone claiming to be their grandchild, saying that they are in an accident or they've been arrested or even in the hospital and they're in another country, they're far away, they can't access their cards, and so they need you to send $500 or $1,000 to get them out of jail or to pay this medical bill, and it's urgent and they need it right now. Just send the money to this number or to this Venmo account. Be super cautious of this. First things first, check with your family members. Check to see if your grandson is even in Mexico right now. the best thing you can do is reach out and verify first. You never want to send money to someone that you've never talked to before, claiming that they know your grandson or your daughter or your friend. Confirm first. Urgency is one of the number one ways that people try to get you to send them money. And that's how you know that it's a scam, is it's urgent. You have to do it right now. So be wary of this. Our next one are temporary holiday jobs. So as you all know, it gets super busy during the holiday season. We're all buying gifts. We're getting Amazon packages. We're all running to the store constantly. And so these retailers and delivery services need a lot of extra help around the holidays. But be careful of any solicitations where you have to actually pay to get a job lead, or anything that requires you to send in a lot of personal information, or it's like a third-party site. Go to the retailer's main website to see if they're actually hiring and go directly through them, or even go and apply in person at this job. So anything that requires cash money, any sort of interesting ads, or anything that seems too good to be true probably is. So watch out for those, especially around the holidays. Next, we have free gift cards. Wouldn't that be awesome? So right now there's a lot of pop-up ads and emails sending out saying free gift cards from Target, free gift card for Amazon. These are just ploys to get your personal information so that they can scam you later on or potentially steal your identity. So anything that comes in the email or some text from a number you've never received, don't download any links, don't click on anything. It's super unlikely that Amazon is going to send you a $100 gift card just randomly out of the blue. Also, be wary of any suspicious emails. Just because it says Amazon as the name, if you hover over it, it'll show you the actual domain, and it'll probably be xyz1234@hotmail.com, and that is not Amazon. So watch out for that. Now we have durable medical equipment, or DME. So y'all are so fast. Y'all are so fast in the chat with the Grinch. Y'all are hilarious. I'll have to download the chat afterwards and see who got it first. But DME is not free. Don't let the holidays fool you. Someone is always paying, right? So if it's not you, it's Medicare. If it's not Medicare, it's someone. So watch out for any suppliers who are offering free medical, free durable medical equipment, but just ask you for your Medicare number. If it's free, they don't need your number, right? And so they're actually going to end up billing Medicare. Watch out for any packages that have durable medical equipment that you actually didn't order. That goes hand in hand with the diabetic equipment that we were talking about earlier. Be super wary with that. If you've never ordered it, go ahead, send it back, report it, and don't pay any return fees. You did not order this. This is not for you. Don't give any money to them. And also any beneficiaries who willingly allow their Medicare number to be used in exchange for money, gifts, unnecessary equipment. These are kickbacks, and it's illegal. Okay, that is fraud. So do not give out your Medicare number in exchange for money or some awesome gift. It's the holidays, you need some extra cash. This is illegal. Okay, so please steer clear of this. Now we have fake shipping notifications. I'm sure we're getting so many alerts on our phones and our emails about our packages. I got one this morning from Amazon about the gifts I ordered for my nieces. And so of course we want to watch and see where our packages are, hoping that they get here on time. But watch out for any fake shipping notifications. These can come from those sketchy email domains, and they can have attachments or links that they're asking you to to download or to open, and it can actually put malware onto your computer or your phone or your iPad. And these are viruses that can steal your identity and your passwords. It's tracking your device and where you're going, and it can slow down your device as well. And so not only are you dealing with identity theft, now you have to go get a new phone. So don't be fooled by this phishing scam. It's just sent out to tons and tons of people. Just verify, go to the actual website, go to Amazon, and you can track your orders through there. Okay, now we have phony charities. So of course, everyone is in a very giving mood around the holidays. We all want to give and share that Christmas holiday joy. But unfortunately, scammers take advantage of this. So they create fake charity solicitations, and they'll send it out through email or put it on their Facebook, or even send you texts. Okay, so please just verify. You can go to www.give.org. So that's the BBB's website, where you can actually check and ensure that these charities are accredited. So just do a quick search, do your research before giving. Okay. On the fourth day, we have holiday apps. And so there's that's too funny. Y'all have Grinch typed out in your chat, just waiting, and y'all hit enter. Y'all are hilarious. Okay, let's go back. Holiday apps. And so around the holiday season, there's a bunch of super fun stuff that you can do, where you can get apps where you can video chat with Santa, or light the menorah together, or track Santa's sleigh on Christmas Eve. I remember I loved doing that on the computer when I was a kid. But a lot of these can be too good to be true. These free apps can contain a lot of advertising, or even have like things where you can click on it and it actually downloads malware onto your device. And so just be cautious, be wary, watch what your kids are doing on your phone. Because you don't want to have these viruses on your devices. Okay. And thank y'all for pointing out the Grinch.
Angel, I'm going to ask you a question. Can you repeat the rules for your game? Because it had to do with the Grinch, plus they had to tell you what scam, so we knew what slide it was on, right?
Yes. Okay. So it is the first person to say where the Grinch is, what slide it is, the slide of the scam. You got to add the slide of the scam, because then we don't know if you're referring to the last one or the next one, right? So yeah, exactly. It has to have the scam on it, just so you know. Thank you so much. Thank you. Yeah, I see a lot in here that's just Grinch, or Grinch and scam, but which scam is it? It has to be a little bit more specific. So I'll download the chat and we'll see. But okay, on the third day, we have unusual forms of payment. I'm sure everybody is pretty familiar with that. Let's see. Ooh. There we go. So anyone who is asking you to pay for holiday purchases with prepaid Visa cards, those debit cards, or any sort of gift cards, wire transfer, third parties, be wary of this. These payments can't be traced. They can't be undone. You can't get a refund for them. And so if someone is asking you to pay with a Visa gift card, red flags should be going off immediately. So do not use any sort of unusual form of payment. Make sure that they are a trusted retailer, because you might not ever get your money back, and you might not get any sort of purchase in return. So be wary of those. Now we have travel scams. I'm sure we are going all over the place right now. We're going to visit family, our friends. Y'all are so funny. There's with all the holiday travel, there's a lot of bargains out there. Be super cautious whenever you're booking through online ads. don't send money to anyone that you don't know, and make sure you're asking for references. Do Google searches, make sure that these are legitimate people, or else you might end up spending a lot of money and not even get a plane ticket or not actually be able to book that hotel. So make sure you're doing a lot of research, especially when you're traveling. And finally, on the first day of the holidays, a true scammer sent to me the puppy scam. I'm sure everybody in their life has asked for a puppy or a kitten for Christmas. For me, it was a horse. I wanted a pony. But be very careful when you're buying pets online, especially during the holidays. I know a lot of kids are asking for puppies right now. But whenever you're buying these pets online, you might actually end up with a puppy mill pooch, which may have hearing problems. It might be deaf or blind or have other health issues. Or you might not even get anything at all because it was a scam. So you might get a really low quality puppy that won't last very long, or nothing at all, just be lost all of your money. And apparently right now it's very popular to do this scam with birds. Apparently a lot of people are buying birds online. That's the cool new thing. And so they say pause first. So pause and research prices. See what other people are paying for this type of animal online. Just cross-reference and make sure that this isn't insanely cheap or super expensive compared to what's on the market. Go to Google and search by image. Whatever picture that the seller has sent you, go ahead and put it into the Google search by image, and it'll come up and say if it's a stock image or if they got it from someone's Facebook, if it's even a real puppy. Okay, so you want to make sure that it's legitimate. And you want to meet your pet in person first before you start giving money, right? Make sure that they're a real animal and that everything's okay with them. And always use a credit card. Use a form of payment that can be tracked and that can be refunded. Don't send cash or a money order, especially if you haven't met the animal yet. It's very likely that you'll send that money and never get anything back in return. They'll just completely vanish. You can also look on the humanesociety.org for this information. Don't let these scams ruin your holidays. So whenever you're buying online, just make sure you're inspecting those links, making sure they're actually legitimate. Type in the website. Don't go through ads or third-party sites. Stay on the platform that you're on. Don't be clicking through and jumping to different sites because you could end up on a fraudulent site, a site that's not actually legitimate. And read everything super carefully so that you know what you're spending your money on. And research. Really just do your research, a quick Google search, cross-reference, ask your friends or family what they recommend. So that's what we just really encourage you to be doing, is just be thank you. I'm glad y'all enjoyed the game. But be wary whenever you're buying online right now. Also watch out for any reviews online, for testimonials. These can be made up. Anybody can post that. I can ask my brother, my sister, my third cousin if they'll go write me a 5-star review. Or there's a lot of things. Give our company 5 stars and you'll get a gift card. That happens a lot. And so these testimonials probably can't always be legit. And pictures can be altered. We can Google pictures, we can Photoshop. And so don't trust just anyone online. And that's all. We have some awesome resources here at the Texas Senior Medicare Patrol related to Medicare fraud and all sorts of awesome presentations. If you have questions or if you have any requests for presentations or for healthcare trackers or information, please give me a call, send me an email, and I can get that over to y'all. Thank y'all so much for playing the game. It was hilarious watching the chat blow up. I
want to say that some people were very clever because they had received the slides in advance. So they all had the slides. And so I think there was a few people that were smart enough to go get the slides and see what one was coming up next. So
You know, I can't even be mad at that. Good job.
Very ingenious. I mean, I'm not saying that's what happened, but it's a little interesting how fast those those came up. That was great. Good for you. Good for you.
That was good.
Y'all are
Yes,
so funny.
Yeah.
that was good. And
Um,
I will let Angel and Marty determine the winners for that while I do the questions from the Q&A.
Wonderful. Thank you.
I was trying to, I don't know if, I guess it's not going to give, is that my whole, when you guys try to open the picture I did, what do you get? Do you get the picture? I posted the chat.
I saw a picture. It says JPEG and it has to be saved.
Oh no, wow. I'm sorry. I thought you
Yeah.
could do it. Sorry about that. That's a picture of my new dog.
Oh. And Marty was one of the first ones in Medicare Monday to talk to us about Medicare fraud and show us that fraud picture that he has.
That's right. Just so you know.
Okay.
If you look at my picture,
that was him in his younger years.
Yeah.
All right. All right. Well, thank you, Angel, and thank you, Felicia, both for presenting some great information. And it is definitely something that we can share with others so that our entire community can stay safe and well informed, because there's no way we can reach everyone with just a few of us. So it does take all of us to help keep our community safe. There were a few questions in the chat. Somebody asked to explain marketplace coverage. Marketplace coverage is the health insurance marketplace that's available for people who don't have coverage through their jobs, or maybe it's too expensive through their jobs. They don't qualify for Medicare, and they don't have options for other insurance. So that marketplace coverage is available. And healthcare.gov is the website that individuals can go to and see what is available for them. Hopefully that answers your question.
If you guys have any other questions, can you put those in the chat or the Q&A? And while they're doing that, why don't I go over the CEU requirements one more time? That kind of gives them a chance to put them in and you a chance to read them. Is that fair enough?
That's fair.
And did you? I was looking at trying to make sure I saved the chat, and I didn't listen to your answers. But did you see the 3 of them in the Q&A?
Yes, that's the one I was starting to answer.
That's great.
Yes.
That's what I want to know. Okay, so if we could, I'm going to just go over the CEUs one more time for everybody who's joining us for CEUs. Today, we're set up to provide CEUs for licensed social workers and licensed professional counselors in the state of Texas. We're also offering certificates of attendance. You're more than welcome if you have a different license in Texas or you have a license outside of Texas. You're more than welcome to go through the process and get a certificate, but just know these are the only 2 that we're set up to provide. I have had people tell me they've been able to use them for other, but that's a third-party information and there's no way I can guarantee that, but you're more than welcome to go through the process. Today's webinar is worth an hour and a half of CEU credits. You must have attended the entire webinar, not miss more than about 5 or 10 minutes at the very most. And of either this morning or this afternoon's Q&A with recording with live Q&A. Lord, I'm having trouble. You must also complete the Google survey that should pop up as you close out of Zoom today. If it doesn't pop up because of pop-up blockers or whatever, you'll also receive that in the follow-up email. I know there's a few people that even had a hard time accessing those links from their work. You might have to forward that email to your home or something to access it. I don't know how all those pop-up blocks work, but I do know the vast majority of people have not had a problem getting into them. The Google evaluation will be up for 1 week till 5 p.m. next Monday, and then give us till the 9th of next month if you would to get the certificates out to you. And then do you want to? There you go. Why don't we leave it there and let you guys answer the questions?
All right, wonderful. Thank you, Marty. All right, so we did answer the question about marketplace coverage. There was another question about, is it always better to have traditional Medicare versus Aetna Medicare? And that's really a personal choice. It's really between you and your medical providers. Because you mentioned Aetna, I am guessing you're talking a Medicare Advantage plan, and those Advantage plans have their own network. So it's important to check with your providers to make sure they are within a network of an Advantage plan before enrolling. And the traditional Medicare versus a Medicare Advantage plan have different payment structures. So it's really a personal choice. It's best to do a comparison at medicare.gov so that you can get an estimate of the cost based on like the prescriptions you're taking, and then what copays are, what cost sharing is available through each plan, Advantage plan. Or is it better to have a commercial Medicare plan such as HMO or PPO? Again, those are Medicare Advantage plans. And in the Medicare and You handbook, it does discuss the difference between HMO and PPO, where PPO does allow you to go outside the network, and sometimes you could pay a higher cost. So again, it's a personal choice, but it's best to do a comparison on medicare.gov and check with your medical providers. I don't see any other questions in the chat or the Q&A. Marty, do you see any others?
Another one just popped up.
Oh,
One
okay.
just popped up.
A patient signed up for Medicare Advantage and the Marketplace. He wants to keep both because he is signed up with his spouse and mother on the Marketplace. Will he have any penalties for keeping both? I would suggest he talk to the Marketplace about that. If he has a Medicare Advantage plan and the Marketplace, he will not be able to coordinate those insurances, and he may not be able to get any subsidies if you keep Marketplace insurance. So checking with the Marketplace about what coverages are available. If you have an Advantage plan, that's a Medicare Advantage plan, so there would not be any penalties if you enrolled, if the client enrolled during his enrollment period, his initial enrollment period or a special enrollment period, depending on when he originally enrolled. For more information or to give more specifics, I would suggest contacting your local SHIP to see if they can assist with that. All right. Angel or Felicia, did you have any closing comments?
No, I really have enjoyed it. And Angel, I love the game. I just wasn't fast enough.
I didn't realize that people were so sneaky and so smart to go.
Well, there you go.
Oh, wait,
Have
what
it
Marty?
pre-typed.
Yes. I think I
didn't
sent
even-
my Grinch to Melinda. I just wasn't
What-
fast enough.
What is that saying about me?
I was going to say the same thing. What
You're
is
doing-
that? What's that?
No, it's just I was like typing like, okay, but I forgot I had sent you a message.
Right.
And it
right.
stayed there. It stayed there. I mean, your
He's
name.
trying to tell me something. That's what it is.
No, not at all. No.
I loved it. Thank y'all
You and
everyone
the
for
Grinch.
participating. It was so fun. It was cracking me up for like honestly. So it was great. Thank y'all.
Very good. Well, thank you, Angel. Thank you, Felicia. And thank you, Melinda. We certainly appreciate y'all. You guys, we look forward to you joining us next month for What's New in 2023 and the top 10 scams of 2022. So thank you all for joining us. Please don't forget to fill out your surveys, and you all have a wonderful day. And please also know that we're going to replay this afternoon and be here to answer questions. So if you have anybody you feel that would be that you'd want to share the information to, feel free to or help us get the word to them. We'd love to have them on. Have a great day.